Hi, I'm Mike Busch. I live in the city of Annapolis, and I've been very privileged to represent you in the General Assembly for over the last 30 years. I live here, went to school here, went to St. Mary's High School, coached football and basketball, and taught history. But I've always been driven by public service. I was influenced early on in my life by John F. Kennedy and Martin Luther King. And I've been very fortunate to have two daughters, Aron and Megan, and a lovely wife, Cynthia. We've enjoyed our time here in the city of Annapolis and feel very much part of the community. I'm running for the Maryland House of Delegates once again. There's 1 or 2 nominations in 30A. I hope you would consider me for one of those choices. Since I've been in office, I've become the Speaker of the House, and which I oversee 140 other legislators, and try to find solutions for what we consider our challenges to the state of Maryland. I've always put a lot of emphasis on K-12 education, public education, because I believe that's the great equalizer in life, that every child that has an opportunity to get a quality education has a chance to succeed. And we've worked very hard on that, invested a lot of money into it. And as a result, during the O'Malley years, we were ranked #1 in the country for 5 years in a row. We've slipped a little bit under the current administration, but hopefully we can retain our status as #1 public school system in the nation. I'm very proud of the healthcare system that we've created here. We have a healthcare system with 2 of the greatest research hospitals in the country, Johns Hopkins and the University of Maryland Medical System. There we have a shock trauma unit, which is second to none in the country, if not the world. We have Dr. Tom Scalia, who leads that, but it's the emergency medical system from the ground all the way up. And everyone in the state of Maryland knows someone that's been affected by shock trauma. You know, if they can get to you in the golden hour, 98% of the people that shock trauma gets are saved. That's one of the greatest insurance policies that anyone can have. We've worked very hard at covering people for health insurance until the Trump administration tried to dismantle the Affordable Care Act. We had 94% of Marylanders had health care access through either Medicaid, Medicare, or the commercial marketplace. We're currently in the position right now of trying to stabilize the health care market because of the actions taken in Washington, D.C. to make sure people still have quality health care. We think we're going to accomplish this year, working with the governor, the Senate, and the health advocates here in the state of Maryland. We are going to make sure that people that are in the individual marketplace, that are some of the sickest and most chronically ill, will have health care, will continue their health care coverage. So we're committed to that this year. We're also committed to the environment. Over the years, we've passed critical area legislation trying to protect the land from overdevelopment, protect the Chesapeake Bay and its tributaries. We have a very vibrant program, open space program, which is unique to the state of Maryland to preserve land so it's not overdeveloped, so we can have parks and not only active, passive parks throughout the state of Maryland. We also have had a very active oyster restoration program for the last 10 years. They're the natural filters of the Chesapeake Bay. And, you know, the rating of the Chesapeake Bay has come up significantly since we started that program. It's had a tremendous impact and effect. We worked very closely with the Chesapeake Bay Foundation, which is a great organization, advocacy group. So we're working in that direction. We're also proud of the fact that because of our education system, we've been able to have a well-educated workforce, which has helped us establish the highest median income in the country for the last 5 years in a row. They're prepared to go in the workplace when they leave our colleges and universities, and the high-paying jobs that are created in this area, it's because we have a well-educated workforce, and many of the companies want to come here. So we're very proud of what we've put together in that area. We do have challenges. The opioid crisis is one of the great challenges we face. We're working together with the governor, the county executive in this county to make sure that we have all the necessary tools to deal with the opioid crisis. It's a crisis that's going across the country, not just here in Maryland. But we need to solve the problem, and working together, hopefully we're going to be able to do that. In my time in the legislature, I like to think that I've been a collaborative individual that has tried to bring people together from different philosophies, different regions of the state, and make sure that we get to a consensus to pass legislation that benefits everyone. And once again, I just say it's been a real privilege to serve the community of Annapolis, and I feel very humbled by the opportunity to be able to do that. Look, I hope you look very closely at all the candidates. Elections are very important. It determines what's going to be priority over the next 4 years in the General Assembly, the County Council. The primary, which is very important, is on June 26th. There's 4 people running for the House of Delegates. You can select 2. I hope one of those candidates will be me. Also, if I'm fortunate enough to get through the primary, I will be on the ballot in November, and you will once again get to choose 2 candidates. So that's an opportunity that I hope to experience, and once again serve the citizens of Annapolis.